Hi, everyone. Thank you for joining us today for our webinar on COVID-19's impact on the Native American community as part of our Amplify Equity series. I'm Nicole Santero, and I'm the Director of Communications for the UNLV School of Public Health, as well as a board member for the Nevada Minority Health and Equity Coalition. I just want to start off by thanking the sponsors for today's event, which includes the Nevada Minority Health and Equity Coalition, UNLV School of Public Health, Nevada Office of Minority Health and Equity, Nevada Commission on Minority Affairs, UNLV Center for Health Disparities Research, and Dreamsicle Kids Foundation. We have 3 guest speakers today who you'll learn a little bit more about throughout today's webinar. We first have Dr. Crystal Lee. She's the founder and CEO of United Natives, as well as the assistant professor at University of New Mexico College of Population Health. And then we have Harriet Parker, Safety Officer and Emergency Management Coordinator for the Las Vegas Paiute Tribe, HHES. And then Dr. Melissa Kelly, Assistant Professor at the University of Texas at Austin School of Nursing. So again, throughout this webinar, they're going to provide insight on their respective areas and help answer any questions you might have. So during this webinar, feel free to ask your questions in the Q&A box. We're also live on Facebook through the Nevada Minority Health and Equity Coalition. So there's more folks in there in addition to our current Zoom chat right now. So feel free to write your questions on either platform. Our Q&A segment will take place right after all speakers' presentations, so keep that in mind. With that being said, I am happy to introduce Dr. Crystal Lee, who will also be helping to moderate today's webinar. She's going to talk a little bit more about her background and work during her presentation later. But just a little bit about her. Dr. Lee was born and raised on the Navajo Nation. As mentioned, she's the founder and CEO of United Natives, an organization centered on enhancing Indigenous communities in solidarity to advance the mission of mentorship, leadership, health, culture, education, and community engagement. She serves on several organizations, including the United Nations North American Caucus, UN Indigenous Women's Caucus, UN Gender Equality Task Force, Board of Director for the Las Vegas Indian Center, L'Oreal USA Diversity and Inclusion Board Member, Vice Chair for Clark County Democratic Party, Native American Alaska Native Caucus, and member of National Native American Policy Committee for Biden and Harris. Dr. Lee is an Indigenous scientific researcher focused on Indigenous health, infectious disease, preventative medicine, and health policy. And again, she's currently an assistant professor at the University of New Mexico College of Population Health, as well as an Indigenous HIV/AIDS Research Training Fellow at the University of Washington Indigenous Wellness Research Institute. So with that being said, I would like to pass it along to Dr. Lee. So Dr. Lee, if I could ask you to turn on your video and your unmute yourself and take it away.
Okay, here we go. Can you hear me and see me? Hello, everyone. Thank you for that introduction. I'll go ahead and add on to that as we move forward, but I would really like to highlight our first speaker in today's panel. Her name is Harriet Parker, and I would like to introduce her. Harriet was born and raised in Las Vegas, Nevada. She is an enrolled member of the Village of White Mountain, Alaska, as well as an original shareholder in the Bering Straits Native Corporation. Harriet began her career with the Las Vegas Paiute Tribe over 16 years ago, working in accounting and medical billing before becoming a safety officer and emergency management coordinator. When not at work, Harriet is a victim advocate and a public speaker for the nonprofit organization Stop DUI. She is a member of the Red Rock Veterans of Foreign Wars Auxiliary and is currently working toward becoming a volunteer with Red Rock. search and rescue. When Harriet is not volunteering or furthering her education, she spends much time as possible with her family and 2 rescue dogs. I would like Harriet to go ahead and discuss some of her work here in Nevada as it relates to COVID. So Harriet, I'm passing the baton to you.
Quiana, or thank you for that introduction. I really appreciate it. I also want to just take a moment and say thank you for the opportunity to participate in today's discussion. I am truly honored to be able to speak on such an important topic. I was able to reach out to several of my colleagues and ask them, I didn't want to speak just for myself or all of my experience. I wanted to be able to reach out to others and ask some of the issues that they have found, the impacts that have happened with COVID-19 throughout the state of Nevada. A few of the things that I have found being at the forefront currently is the vaccine process. It's right at our doorstep. As a matter of fact, I heard on a call this morning that there are several tribes that have already received the vaccine and are looking for the protocols, or looking at the protocols to start administering them. However, I have also found that a lot of tribal leaders are hesitant to offer the COVID-19 vaccine due to several reasons. First off, being historical mistrust of government or outsiders. Another thing that we've discussed is the tribal populations are very low in some tribes. For example, the Las Vegas Paiute tribe, they have 55 adult members, of which about 40% are elders or those that have high-risk health factors. So the fear of the COVID-19 vaccine weighs heavy on them. They are concerned with how the trials were held and how, because it's only been about 10 months, the fear is what's going to happen next year or 3 years or 5 years from now. So that's something that has really raised a lot of concern regarding the vaccine that I have found through my discussions with others. As mentioned, the vaccine trials, there were questions of how they were conducted. And it's my understanding that the first few phases didn't even include the Native American population. So the question raised is, are the trials reflective of the true data of the Native American demographics? A few of the other things that I've run across with speaking with my colleagues here in Nevada is the need for a Nevada epidemiology program for tribes. Currently, the state of Nevada does not have a tribal epidemiology program. The Intertribal Council of Arizona is receiving funding from IHS, or Indian Health Services, to provide epidemiology services for Arizona and Nevada. However, since the COVID-19 pandemic, this obligation has not been fulfilled. Tribal clinics are not required to report COVID-19 cases to their local health district, which leads to confusion on reporting, causing the actual number of COVID-19 cases to be inaccurate. I can say on a personal note that here at my tribe, in the very beginning, I used to report that we had 0 deaths. About, 2 months ago, I believe it was, the diabetic coordinator came to my office and said that he had spoken with the family members of one of the members of that program. He had called to make an appointment with that patient, and the family answered and said, "Oh, you weren't aware they had passed away?" He said, no one reached out and told me. They said, well, it was due to complications of COVID-19, and this patient had passed away in the hospital. We were never notified from the health district. The only way we found out is because our diabetic coordinator was reaching out to them. to follow up and to make an appointment. So there's definitely a breakdown in communication between the tribes and their health district, their local health district. I know that on our end, we've tried to reach out to each other, and a lot of the numbers get mixed up. So I think that by adding an epidemiology program for Nevada would help in stopping the confusion. It would make the reporting process a lot easier, and it also would make the numbers more accurate. This would also remove the burden from the Intertribal Council of Arizona and provide a more consistent reporting protocol, thus allowing accurate numbers of Native American COVID-19 cases, whether it's the number of positives, negatives, recovered, or even deaths. Another thing that we found after many discussions is also the need for increased funding to hire Native Americans. And these are for positions such as screening. Due to COVID-19, some tribal clinics have had to hire additional personnel for screening purposes. In our tribal community, when a patient arrives and is greeted by a Native American screener, they feel more comfortable with providing the information needed. They feel more comfortable with the screening process, knowing that it's someone that's also a Native American and can understand the issues that they have. This also carries over to contact tracers. When someone in our community receives a call from a contact tracer, knowing that they are Native American, to make them feel more at ease with providing the necessary information. Again, going back to historical mistrust. I know here at our clinic, we've had several people that have mentioned to us, and patients have mentioned to us that when they receive a phone call, they usually don't answer the call if they don't recognize the number. So when a message is left, they sometimes don't feel comfortable calling them back. They are concerned. They're worried about the information that they would provide and where that information is going. I think that by having the ability to hire more Native Americans in these positions would allow our community to feel more at ease with providing that information and not feel that this information will be used against them or for any other reason than contact tracing or for screening purposes. These are just a few of the issues that I know that have impacted our community here. I would speak mainly on the Las Vegas Paiute tribe, but I know that there are several other tribes in Nevada that have had these same issues. We've spoken on them in different conference calls. So I know that there are other people on the panel that will have more information to speak to several others. I could speak all day on the other impacts, but I'd like to leave a little bit to the others as well. So I would like to say thank you, or Kuyana in my language, for this opportunity to speak, and I look forward to any questions anyone might have. Thank you.
Thank you, Harriet, for some brief background. I do have a question. Is there anything specific to Nevada, since you work at the Las Vegas Paiute Tribal Clinic? So there's two questions. Is there anything specific to Southern Nevada versus Northern Nevada that has distinct challenges as it relates to COVID? And for all the Nevadans in there, I think this is would be an interesting observation.
So a couple things that we have found actually comparing Southern Nevada or Las Vegas to the tribal members and the tribal communities in the north, we are more urban. So I know that there are tribes up north. They've had some difficulties as far as testing. When in the very beginning, Abbott analyzers were set aside for Nevada tribes. And they have a limited number of these Abbott analyzers that they were going to provide. Las Vegas was not one of them. And we never heard why, but it was our understanding that probably because we are more urban and that testing is a little more readily available. Here in Southern Nevada, for our tribe specifically, we've been very lucky as far as the testing. We have had access to testing here at our clinic, but then also on the outside, which again kind of goes back to the epidemiology program, because while we do offer testing here at our clinic, some of them may not be able to come during the times that we've allotted for testing, which has led to, again, a problem in reporting. So the tribes up north, I know that they've had trouble with, because they are more rural, they're frontier tribes, they've had trouble getting their ID kits for the testing. They've had some issues with that. That's just one of the things. I know another thing that I didn't really touch on, but that I know that they're having issues with is telehealth. Here in Southern Nevada at Las Vegas, the Las Vegas Pirate Tribe, we were doing telehealth appointments. And now that school has started and there's distance learning, I was actually shocked to find out that the Las Vegas Pirate Tribe has been limited several times by the local internet provider. They've held back our data a little bit. So we've had telehealth appointments that have been dropped or frozen. They were unable to connect. And that's here in Las Vegas. Those up north, there are several tribes, I don't have an exact number, but there are several tribes that they don't even have good internet access because they are so rural. So they definitely have a struggle as far as being able to receive the services that they need, receive the telehealth appointments that are needed. Those are just a couple of the things that do separate Las Vegas or the Southern Nevada tribes from the northern. Those are just a couple. I'm sure there are plenty more that I don't have an answer to at the moment, but I know there's been quite a few struggles.
Thank you for that. As indicated, we can open up for Q&A after each panelist. So, okay, we have a question here from Erin Luna Barajas. Sorry if I said it wrong. What are some of the main concerns that the Native American community has about the COVID-19 pandemic?
So, as mentioned, there is a fear of the pandemic from the very beginning. What we found is that, for example, the CDC has put out a lot of information. The information is so far and vast that it's a struggle sometimes for our community to read through all the information. Plus, it changes so much. Another thing that was brought up was that the CDC tried to, well, they didn't try, but they have a section for tribal communities. So the information provided is geared towards tribal communities. However, it's a very small section. There's a lot of things that aren't mentioned there in those areas. A lot of times in our community, we do have multi-generational homes. There is a little bit of discussion on that on the website, on the CDC website, but there isn't a lot of information that's geared specifically towards tribes and the culture that we have. So that, along with the fact that the information changes every day, which we all understand that it can, but it is hard for a lot of our community members to find the most up-to-date information. So they really rely on people like myself, people who, again, going back to the contact tracers, our nurses, our screeners here at the clinic, to help provide that information and give them the most up-to-date information. That's just a couple of things that I'm aware of, that I know that the Native community has had regarding the COVID-19 pandemic. And I'm sure there are others who can also answer this question as well. Thank you for the question.
Thank you. That will be a continuing question that each panelist will answer as we move forward. If we have any questions specific to Harriet in Nevada, especially Southern Nevada, we can take maximum 2 more questions, but we should really move on to the second panelist after taking the final couple of questions specific to Harriet and Southern Nevada. And if not now, if you think of something in the future, we can always circle back around and ask Harriet the question moving forward. So we'll just keep that in the question box. Okay, our second panelist, excuse me, Harriet, thank you so much for your presentation. We truly appreciate it. And we know that Harriet might have to leave sooner than the indicated timeline. So I just wanted to give a big appreciation to her, and in the case that she might have to log off sooner than later. So much appreciated, Harriet. And now on to our second panelist. Her name is Dr. Melissa Kelly. Dr. Kelly is currently an assistant professor at the University of Texas at Austin in the School of Nursing. She is Native American, Kituwa Cherokee, and one of only 25 Native American doctoral prepared nurses within the United States. She graduated from Florida Atlantic University in 2016 with a doctorate of philosophy in nursing. She just recently completed a postdoctoral fellowship at Florida State University and worked with Dr. John Lowe in developing the first ever Center for Indigenous Nursing Research for Health Equity Center. Dr. Kelly is passionate about conducting health disparities research among Native American and Indigenous populations in the areas of risk prevention for Native American youth and substance abuse, use, obesity, mental health, and STI, HIV/AIDS, and health disparity issues among Native American and Indigenous women. She has gained experience utilizing the Cherokee Self-Resilience Model and Native Resilience Model, utilizing principles of the community-based participatory research approach, and with conducting randomized trials for the prevention of health disparity issues such as obesity and substance abuse among Native American youth and young adults. We are pleased to have Dr. Kelly here. She is a good friend and colleague of mine. We are both doing the fellowship at University of Washington under Indigenous Wellness Institute. She's part of the cohort, and with that, she became a good friend. So, Dr. Kelly, the floor is yours.
Thank you so much for that great introduction, and I'm honored to be on this panel with you today. I appreciate you reaching out. As she said, I'm Kituwa Cherokee. I'm originally from Oklahoma. And I'm really going to speak to a little bit on the Cherokee Nation tribe, because unfortunately I can't speak to all of the other 38 tribes in Oklahoma, because we have quite a few number of tribes. But I was looking on a website just recently, and so they kind of broke it down into, there's not all of the information up there is there for every tribe, but I'll go over, you know, some of the Cherokee Nation information. A lot of their supplies, especially for COVID testing right now, obviously here are supplied by the Indian Health Services and FEMA. Now for here, I think they only do rapid nasal swabs. And right now, we don't have the capability yet to do antibody testing. So none of our clinics are doing rapid testing. And as far as vaccine goes, I think that's the jury's still out for a lot of our tribal members. A lot of it is fear. And then also, as Harriet talked about, is that mistrust of the use of information. So the jury's still out on the vaccine. There's not a lot of them jumping in line to say, hey, I want to do it today. So, but I don't know, did you want me to show the map right now, or did you want me to wait, or does it matter?
Sure, whatever you prefer.
Let me pop it up. Oops, sorry. Let me see if I can get it pulled back up. Oh God, where did it go? There it is. Nope, that's not it. Sorry, wrong one. Uh-oh, where did it go? Oh, my little map disappeared. I don't know where it went. Oh no. I don't know where it went. I was going to show it. Anyway, I'll do the total number. I did have a nice little map of the Cherokee Nation. The Cherokee Nation is actually it's a 14 county tribal jurisdictional area in the state, mostly the northeastern corner of Oklahoma. And it, like I said, it includes 14 counties. So far, the total cases just for the Cherokee Nation itself is 2,334. And so far, we've had 22 deaths within our tribal jurisdictional area. Now, for the state of Oklahoma, we have 186,000 cases and a little over 1,000 deaths, almost 1,100 deaths in the state of Oklahoma. Like I said, I had a better map. It looks like, as far as looking at how it's spaced out as far as gender, it looks like more of the deaths have been females than males. Kind of interesting. And I had a graph that showed the age differences, but I think the majority of our deaths have been the 40 to probably 65 age category. That's been our experience with that. But so that's kind of all I have as far as that goes. Like I said, and then for contact tracing, it is all done through their health services. And as Harriet said, I believe they've also had to hire additional helpers. And each of our clinics, we have several clinics, they have their own testing sites. So each clinic pretty much has their own tent set up outside to do testing. And they've been doing it, even up until last week, they were still doing it. And I don't know if I want to include myself in the statistics, but I did just recently test positive, which I had no symptoms. So I'm grateful for that. And the contact tracing people within the tribe are nurses. They seem to be very compassionate, and they really call to check up every day just to make sure you're okay and not displaying new symptoms. And so then toward the end, whenever it was time for my quarantine to be completed, they were very, like every day they would go through all the symptom check, but then they would remind you that if you have new symptoms, please don't hesitate to, go back to be seen. So, but they were very diligent about calling every day. So like I said, I can't speak to the other tribes, but our contact tracing people seem to be very good and on top of everything. So, but again, thank you for allowing me to be on here today. And if there's any questions, I'll try to answer them to best of my ability. But like I said, I think our tribe, they've been very good from the beginning. And the main thing for them is a lot of our population is older, and they have a lot of health issues. So the biggest one for our people was to basically social distance and obviously, wear their masks when they're out. And so the one question about the concern, I think a lot of it, like she said, is a lot of it is information, and that there's so much of it, and some of it can get very confusing. So helping them to decipher some of that information is what's been probably probably one of the biggest challenges, to cipher through all of that information, because some of it's, in the beginning there was so much, and it was overwhelming for a lot of them. So making sure that even as community people, when we're doing presentations for them, is to try to provide them with the best information possible and the most up-to-date information. So that's all I have. If anyone has any questions, I'll try to answer them.
I have a question, Melissa, or Dr. Kelly, I'm sorry. So you are a clinician by trade, initially. So from the context of being a clinician, and then also you yourself being recently diagnosed with COVID, maybe you can provide us more detail of just further insight of being, I guess, being and testing positive for both. And in Indian country, what might that look like from a clinician and then also a patient perspective?
From the clinician side, I mean, it's still very, it, to me, I don't know, it's hard to kind of explain. It just, my concern was kind of where I contracted it from. And, but, and it does, and with me testing positive, especially having to go into self-isolation or quarantine, it was a little nerve-wracking, because like, oh my god, and my biggest concern is I do have two parents that have health conditions, so my biggest concern was giving it to them. So I was very diligent about any time I came out, just wearing my mask, and making sure I cleaned surfaces where I was at. But in the first few days, I was like, really like, oh my god, just trying to really make sure I cleaned everything. And then just like I said, anytime I came out to be around them, was wearing my mask. But my biggest fear was bringing it to them, and luckily so far both of them were negative. But that was my biggest fear, was and also too, being on the clinician side, knowing that some of my being in Florida, some of my coworkers are challenged with this every day, and I think a lot of them, that's their biggest fear too, is bringing it home to loved ones or even their children. So but I hope that answered the question. But being on the patient side, it was a little nerve-wracking, but just really trying to just distance myself. And then, like I said, wearing my mask, and even now still going out and not knowing, because they said pretty much, after that 10 to 14 day window, you're no longer considered contagious because it's a virus. So their recommendation whenever they sent my letter for release was to still continue to social distance and then wear my mask. So I've been still doing that, especially when I go. And anyway, wearing the mask has been, anytime you're out in public, one, it helps, keep you from probably picking up something else and then from you giving it. So science trial. So, but yeah, and the other thing is, so far, here in Oklahoma, I have not heard too many places doing antibody testing. I think there's a few, but we don't have a lot of sites yet open for antibody screening. Probably more of the hospitals. I know, because I do work for the University of Texas and it's new, they did ask me about possible antibody testing. So, obviously, if I still have the antibodies, that would probably be something I would look into doing, as to donating my plasma for those that are really sick. So I hope that answered your questions.
Okay, thank you. There's another question that just popped up by Tina Dorch. Hi, Tina. So this was in regards to communities of color participating in vaccine trials. Her question is, what steps are needed to occur to provide an environment that results in an increase in tribal participation?
Good question. I think what steps are going to be needed for a lot of ours is to, one, make sure that it's working effectively, because it is so new. A lot of them are probably not going to want to jump in to have the vaccine done right away. And I think, like I said, is a lot of that has to go back with the historical issues with, the mistrust of even vaccines. So I think a lot of people are going to probably wait. I think that's going to be a concern for a lot of people right now. So.
Okay. And Dr. Kelly will be with us continuing on the panel. So if more questions arise, then of course, just please ask via chat. I guess we can segue into my topic quickly, and then after that we can have a final Q&A session. Hello everyone. Thank you for being here on this panel with us today, or on the Zoom, I should say. I know many of you here, but for those who do not know me, I am originally from the Navajo Nation, and my clans are Nato Dene Tachi Nishle, Na Nesh Eja Tambaham Bashichin, Senjikin and Dashache, and Kintlachin Dashanele. We have a 4-tier clan system that derives from our matrilineal heritage. So we always take our mother's first clan first. And real quick background about the Navajo Nation. Again, I was born and raised there, but my primary home is currently Las Vegas, Nevada. My secondary home is Albuquerque, New Mexico, as I'm assistant professor at UNM in the College of Population Health. And then my newly added residence, my third would be Phoenix, Arizona, and I'll talk about why in a minute. So the Navajo Nation is in 3 states. It's about the size of West Virginia. So we have the largest land base out of any tribe in the United States. We have different issues just because of how large our geographical region is. Our land base is in the states of Arizona, New Mexico, and Utah. So then we have a 3-state jurisdictional system, which makes the whole subset of challenges as it relates to COVID more debilitating, if you will. So I'm just going to go ahead and share a few things on my, just to give you some context. So if you can see the screen here, I just pulled this up from the Navajo Department of Health. So the Navajo Nation, we have our own Navajo Nation Department of Health. So they've been doing a pretty good job on tracking all our majority of our cases. So as you can see here, we've had over 10,000 cases to date. At one point in April, Navajo Nation superseded the states of New Jersey and New York State within their prime COVID positive cases. But the Navajo Nation superseded in cases per population capita. So we had a huge growth spurt in cases within a very short amount of time. And within our caseload, within the Navajo Nation, and I do not I am unsure of these confirmed deaths, if they count for Navajo persons residing outside of the Navajo Nation. It's not clear if this is both on and off the reservation of the total confirmed deaths. So we have had a pretty high mortality rate. And I'm just gonna go ahead and scroll down. So this is here, if you could see the map of our tribal reservation. Again, you could see it's in the four corners where the four states meet, and see that majority of our reservation lies in the state of Arizona. And the hot spots have been the center of the Navajo Nation, and then if you're looking northwestish of the Navajo Nation, which also includes the state of Utah and Arizona. So, and then the law, so the state of Arizona, the governor did not have the best preventative efforts early on, whereas the state of New Mexico did. So you can see how the state differential laws impacted the caseload within our tribal jurisdiction. And so this is our reservation numbers currently. And then in addition to that, there was a study conducted, and we don't have the numbers now. It's too soon for the epidemiology of it. But when H1N1 occurred, Native Americans within the state of both Arizona and New Mexico had 4 times the mortality rates higher than those that were non-Native American. So I don't know the number specific to COVID, but the most comparable in recent outbreaks would be the H1N1. So we did have a higher mortality rate as it relates to H1N1 within the states of Arizona and New Mexico. A lot of the issues stem in a lot of ways. There was that question of what are the concerns? So within the rural geographic areas, there's just a basic lack of resources. Within the Navajo Nation specifically, there's 30% of our tribal members do not have running water or electricity within their homesteads. So really utilizing the CDC guidelines and saying to our tribal members, go wash your hands frequently, but if people don't have running water, then how can they wash their hands? Also, there's a huge gap in access to food and resources. So we live in a dry desert area, a food desert area. And so when COVID hit, our community was so under-resourced, even with, we all know that there was a lack of toilet paper pretty much at one point in time. And even a lack of food in the most resourced areas of our nation. Now we're gonna take a step back and think about the most under-resourced due to the ruralness of the geography. And then in addition to that, the food deserts, which had a huge impact within our tribal members. And then in addition to that, not only having not having the basic infrastructure, but we're also again talking about intergenerational households. I don't think that this is specific to rural tribal members. I also think this incorporates urban tribal members. We have a lot of tribal members who live in urban spaces, and a lot of the times they do have large family structures that live with them in urban spaces. And so the contagion would be high risk in those households. And then I think just the lack of the raw numbers. Our tribe has been doing the best that they can on the tracking, but I've been working and talking to our Navajo Nation Department of Health and just all the challenges of tracking the COVID positive cases because of we just weren't well prepared in the beginning, which that left a big lapse on trying to do preventative efforts early on. So it's almost that we were acting in reactive stages versus proactive stages. And that time gap for us to catch up to really implement those measures effectively really impacted, you know, the high spikes within our tribe. In addition, I think there's some other measures to think about. I think tribal leadership plays a huge factor. The response from a tribal leadership capacity. What is the tribal leadership doing to implement some preventative measures? For instance, our Navajo Nation president instituted a tribal lockdown, which means that for continuous weekends, tribal members could not leave their house starting at 8 p.m. on Friday night all the way to 5 p.m. on Monday morning. So our tribal residents had to stay in their house. Now, if you were considered a frontline worker, like a clinician, etc., then you were given authorized documents that indicated that you can leave your household because you're a frontline worker and you're needed. But if you were not um, given those documents, you would be fined $1,000 to leave your house. And so I think that although it might seem a bit radical to tell people not to leave their house on weekends for continuous weeks, that I think that played a big part on preventing further COVID positive cluster outbreaks within certain communities. As we stated, that a lot of our tribal members really didn't have the knowledge, and they may have perceived the virus as something as a problem somewhere else and not in our reservation, or they might have perceived the virus as not as a huge threat. So therefore they felt in some way that they would be okay if they left. And in addition, people really also needed resources, so they would go to the neighboring towns as much as they could to get those resources. And so there would still be a lot of Native people traveling and still in the crowds, if you will, at the grocery stores because there's such limited grocery stores. So it's really hard to implement the social distancing at the time when it was so new. Let me see. These were just, and then also the jurisdictional challenges, working with multiple health departments at the tribal level, at the county level, at the state level. So there's 16 different counties within my tribal reservation. So we have counties in Arizona, counties in New Mexico, and counties in Utah. Now the state, the three-tier state coordination was just horrendous. The coordination with the federal government had even more layers of frustration, because then you're working with the CDC, and then you're working with the Indian Health Service, and you're working with the Health and Human Services, and you're working with the Department of Interior, and you're working with so many layers of feds, and then also 3 different state and county level departments. And our tribal leaders there was just really no efficient pipelines of communication. There was pipelines to implement any effective strategies. Even the coordination alone had an adverse impact on efficiently implementing some of these measures from the beginning. And so I'm going to go ahead and talk about I'm gonna go ahead and talk about some efforts. Now we're talking about all the challenges, but I would like to talk about solutions. And we know that disparities run high in communities of color for various reasons. But I'm gonna go ahead and talk about my nonprofit work and some of the great things that we have done and or currently doing to address this issue. As indicated before, I am founder and CEO of a nonprofit called United Natives. And United Natives partnered with Navajo frontline clinicians during this pandemic. We saw a need to allocate PPE for the frontline workers, so that's how it initially started. So our awareness efforts just kind of skyrocketed, being that the Navajo Nation was heavily highlighted again because we had one of the highest rates of COVID positive persons on our reservation. So part of the efforts that my organization did was allocate resources to distribute on the Navajo Nation. As stated, there was so much resources that were basic resources that were needed. So from the months of April, May, and June, we allocated $700,000 worth of donations within 3 months. With utilizing the 700,000, we bought $100,000 worth of hand sanitizer. We bought $130,000 worth of Lysol. We have actually a contract with the Lysol company now, and we store all this in a warehouse in Flagstaff, Arizona. And these are all the tribal communities that we have served. We served over 40 tribal communities on our reservation with water, with Lysol. And so we've been doing tremendous efforts with our community partners on distributing all these needed resources, not only on the Navajo Nation, but also to the Hopi Nation, which lies within our tribal reservation, which was also impacted hard by COVID, and then also with the White Mountain Apache Nation as well. So we worked with these 3 tribes. And so these are just some pictures of the efforts that have been ongoing. But another one of the efforts that we did at the time was I partnered with someone here in Phoenix, and that's where I'm currently at. And at the time, there was a big need to separate members of the family who were COVID positive from those who were COVID negative. But again, because there's really nowhere to place those COVID positive patients, we came up with a facility to where we rented an entire Quality Inn that has 180 rooms. And within the Quality Inn, each room is a suite. So each room has a full kitchenette. So we transported the COVID positive patients from the reservation to our quarantine site, where they were quarantining on site safely away from their family members. We tested weekly. And I'm gonna tell you this is amazing that there was over 400 Native people who transitioned through our quarantine site. Out of the 400 Native people that went through our site, not one of them was hospitalized due to COVID. Not one of them needed to go into an ICU, and we have had no mortality rates. So early on, what we did was we have a chef, and one of our main ingredients, we think for 100% success rate, was diet. Our chef is, he specializes in plant-based diet. So what this means is 80% of the food that he makes is fruits and vegetables based, and then the 20% are carbohydrates and or protein. And so from initiation, from day one, we feed them 3 times a day at this site. And for since day one, we've been feeding them very healthy foods. And so the second thing that we implemented was supplementary additives such as like vitamin C, zinc, lots of water, lots of hydration. So we did supply them with those. The third thing that we did is we hired a native meditation breathing therapist, because we understood that COVID, impacts the lungs. So with this native meditation therapist, he really concentrates on your breathing and to strengthen your lungs. So we had them go into the meditation therapy, and really with the focus on breathing. In addition to that, if you can see here on the bottom right, this is yoga, and this is yoga for traumatic therapy. A lot of our clients here at the site are also not only were combating COVID, they were also combating other chronic illnesses and or mental health illnesses, which includes substance use, alcohol, drug abuse. So we implemented a yoga for trauma therapy service, and so not only addressed mental health and trauma for therapy, but it also incorporated lung exercises in addition to the other meditation therapy. So again, over 400 Native people has been through our site, 100% success rate of overcoming COVID. And currently, because COVID is at a stagnant rate right now, we have transitioned the sites into more of an addiction use site. And as of last week, there were only 4 people who tested COVID positive, whereas before there was 100% who tested positive. So these were just, so our service worked really well, and I really wanted to discuss the solutions and not just the issues. And in addition to that, I wanted to play, we've also made public health videos for tribal dissemination. And
hi, my name is Alexiana. I'm from Palo River. I am Hopi, Dene, and Akimel Atum. Now I scan up. My name is Inez Gilson. I'm from the San Carlos Apache tribe and Seneca Nation of Indians from Salamanca, New York.
Halitpo Sa'uchiviath Carson Chatasia. Hello, my name is Carson, and I'm a citizen of the Choctaw Nation of Oklahoma.
My name is Randy. I'm from Apache tribe.
My name is Graciana Garcia. I'm a part of the Bosqua Yaqui tribe. My clan is the Chile clan.
Honoring our elders has always been important in maintaining our spiritual tradition. They hold the keys to our future from the wisdom gained in their lifetime.
Therefore, it is crucial that we must protect them from contracting the COVID-19 virus. COVID is an infectious disease. If contracted, our people can have 0 symptoms or respiratory infections, ranging from the common cold to fatal symptoms. People may not know that they are carrying the disease and pass it on to our elders.
Briefly wanted to talk about ways that we can protect ourselves and our communities during the COVID pandemic. First, it's important to wear masks and social distance when possible. Additionally, we can care for elders and others in our community who are at risk by going to the store and buying groceries for them, as well as calling them and talking to them during what can be an extremely lonely time. It's extremely important that we do these things as we protect our elders who are our culture holders, as we take care of ourselves as the current and future leaders of our communities, and as we build a beautiful and safer world for the generations that come after us. Yokoke, thank you.
For me personally, it is important to protect our elders because I feel that they have a lot to teach us and we have a lot to learn from them. I have 6 elders and I have 6 grandparents, and I would feel sad personally if they were to die from COVID-19.
It's important to keep your immune system up. You can drink alkaline water, eat healthy foods, especially citrus foods, like grapefruits, oranges, lemons. You can also add in spinach and almonds. You can get a lot of rest, and then you can also take extra vitamins if necessary, like vitamin C or zinc.
I want to stop COVID by washing my hands, social distancing, and wearing a mask.
Wash your hands.
Okay, I guess we can open it up to Q&A, everyone. So
Thank you, Crystal. Yeah, we actually have a couple questions. So you just showed those videos, which were really great, and in getting out the info about COVID-19 for this community. But for you and Melissa, can you think of, aside from those methods, what do you believe are the best methods of messaging about COVID-19 that you can provide to the Native American community?
well, just aside from the community-based work and public health work, I'm also a principal scientific investigator on 7 different research studies. So in one of the studies is actually, I'm funded by NIH, and I am working directly with the Navajo Nation. And with that, we are still building culturally responsive, Navajo-specific COVID prevention videos. And we are using everything from tribal leaders to Navajo, almost famous athletes, with really using prominent people in our community that our tribe sees prominent, and pushing different messaging forward. And so, and what I'm going to measure in this study is looking at the adherence practices of CDC guidelines prior to watching the series of videos, and then post, to see the effectiveness of adherence to things as washing your hands, face mask wearing, social distancing, different things that we're going to measure. But we're also measuring the cultural responsiveness, acceptability of the videos, where how do they perceive the videos? Is this an effective way to communicate public education as it relates to COVID and or any other, I guess, contagious viruses out there. So I think that the videos are truly effective in that way, and we're going to measure it, so I can give you a better some better grasp on it after the study is over.
That's great. How about you, Dr. Kelly? Do you have any insight on those best methods for getting the messaging out about COVID?
I think
actually the video she played is a perfect way to do it, because they can see the different generations that are message. Oh, am I muted? Oh no, sorry, I thought I was muted. No, I think that's the perfect way to do it. So
some feedback on your end, Dr. Kelly. I'm not really sure what's going on there.
Dr. Kelly, you sounded sounded very staticky or something.
you know what, my internet
now.
Sorry.
You're better now. Now you sound better.
All right. What I was I think those videos are the perfect way to do it, because you have the different generations just giving out the information, and the little one at the end was cute. Wash your hands. But no, I think it is, especially for ours, getting out the information by video is great, but like I think Harriet was referring to, we have a lot of rural areas, so sometimes internet or even Wi-Fi access is not possible for all of our people. But just any kind of messages. I know a lot of stores are displaying like different messages too, and I know at our clinics right now, a lot of our clinics, they're not really allowing patients to come in unless they have like appointments, but giving those out to them whenever they come in the front doors has been helpful too. And but like I said, the videos are like a perfect way to do it, and I think having the generations it's very impactful. Great job.
Thank you. And we have multiple videos. We have one that's Apache, White Mountain or Apache specific. We have one that's Navajo specific. So we have a whole series of videos that we have developed through my nonprofit efforts, United Natives. So you're welcome to share them. I saw a question on here. They're posted on YouTube either under United Natives. They're posted both under United Natives and United Natives Health. And anyone can share them as a resource.
Awesome. And then we have a question about vaccines, because we know this is kind of on the minds of quite a bit of people. Do you all know what the perception of vaccines are in the Native American community?
Like I was saying in my presentation, I think the verdict is still out. There's a lot of people still on the fence about getting them. So like I said, I think they want to kind of wait and see how if it's going to be effective, because there's still a lot of unknowns about the vaccine. And given that I am on the clinician side, we know how long it can take to develop a good vaccine. So, putting one out too early could not, is it really going to work? Is it going to be effective? And then is it going to protect me? Because I was reading some content, and right now, one of the things that people are really unsure about is the presence of the antibodies. Does it really prevent you from getting it again? So I think that's on a lot of minds of people,
I know Navajo Nation, well, it's funny. So the director for Johns Hopkins Center of American Indian Health wanted to meet with our Phoenix site because Johns Hopkins has a site placed in White River, Arizona, where the White Mountain Apache Nation is. And and because we have a lot of White Mountain Apache clients, Johns Hopkins Center for American Indian Health wanted to do a site visit at our Phoenix site. So just to give you, so they did a site visit, but I found out that Johns Hopkins is actually taking the lead on doing a clinical trial with COVID-19 vaccine. And they actually secured the Navajo Nation to be participants on this vaccination trial, which they never communicated that to me personally, but I found out that this was what was ongoing from our reservation. I personally know that a lot of people have a lot of hesitation towards being a participant in a vaccine trial. I personally, separate from a professional level, I do not encourage my family members to participate on vaccine trials so early on without knowing the adverse health impacts. For me, if I'm going to endorse my community from a professional level, I want to know that it's safe, number one, and it's effective as well, number two. So I would not endorse or employ Native people for something that is not 100% safe or even considered effective. There has been a lot of historical guinea pig situations, and I do not endorse the fact that I want my family members in my community to be quote unquote a guinea pig in any type of experimental systems, especially if I don't know the impacts of it. And I could not confidently endorse that from both a personal level and then from a professional level as well.
Absolutely. It looks like we're done with questions, but are there any final, I guess, parting words that either of you would like to conclude with as part of this kind of what to look out for as far as your work? I know Dr. Lee, you mentioned it a little bit, and kind of what's to come and what to look out for. Any tips for the community as we move forward with COVID?
I think my thing is, as things start to slow down, I think right now, and we're also coming up on regular flu season, just continue to be diligent about, practicing good hygiene, when you can, wash your hands if you can, obviously sanitizer if you have it, and then just, especially if you're going to be sick or out and about, just, keep that mask on. It's been a lot for a lot of people, but I think it's also very helpful to do those kind of things, and just, keep your health up if you can, and find healthy ways to manage your stress if possible. I do know that the isolation part can be very challenging for a lot of our, especially our elderly community, but definitely trying to keep your health up and finding healthy ways to relieve that stress and anxiety. Because I think a lot of this early on, even people that probably didn't have anxiety problems, it was creating a lot of anxiety for a lot of people. So that would be my parting words. And then, as things move through, I know we're working on grant proposals for more COVID type education and prevention efforts as well.
Just forthcoming from my end, we are developing a Native American specific health app, which will be housed under our United Natives Health. That is forthcoming, and that's a one-stop shop for everything from prevention to messaging to research to telehealth and telemedicine. So that will be coming in the next couple of months.
Great. And before we go, we got a flyer and some information from the Nevada Office of Minority Health and Equity that kind of wanted to give a heads up on something and to share. So I'm going to put this flyer up really quick. So on October 22nd, they're hosting an All of Us webinar. It'll be a great way to safely ask questions and learn more about trials in general. So if folks are interested in enrolling in a trial, we're going to definitely share this out on our platforms as well. But you're recommended to contact the leads on this, and contact information is here. And again, we'll share it on our platforms as well. But in the meantime, thank you, Dr. Lee, Dr. Kelly, Harriet, who had to go, unfortunately, earlier today. We appreciate you talking about this from the Native American perspective, and we hope to, continue this conversation even further in the future. So more to come. And for those who are here, feel free, this is going to be rebroadcasted. Feel free to share to your further networks later on. But in the meantime, thank you everybody for joining us. Thank you to our speakers. Thank you to all who worked behind the scenes to make this happen, and hope everybody has a great day.
Thank you.